Representative Jeanie Riddle. We're going to be talking about House Bill 1779, and this deals with the abilities that practitioners at Fulton State Hospital have to deal with their patients. And Representative, in the last couple of years, there's been a lot of discussion about replacing Fulton State Hospital. A lot of that discussion has dealt with the age of the hospital and its design and how that plays into worker injuries. And the top facility in the state in terms of the number of injuries that happen to state workers there. But if you talk to some of the current and former staff there, they will tell you that it's not just the building and its design, but it's also the way that they have to interact with patients, what they can and cannot do. This bill is a first step toward dealing with that.
It certainly is. If you talk to anyone who lives in the Fulton area or surrounding communities that have either friends, family that work at Fulton State Hospital, they'll tell you the injury rate is very high, and it's been touted as the most dangerous place in the state of Missouri to work. Because of that, and because of the dangerous nature and the violent nature of a number of the individuals that are housed there, currently in statute for a client, as they call them, rather than patients, to be restrained or isolated, the COO of the hospital or the attending physician are the only ones that can order that. With this legislation, it allows the advanced practice registered nurses to order a seclusion or restraint as long as they're under a collaborative agreement with the attending licensed physician. So they are closer. For instance, at Fulton State Hospital, it's a number of buildings, and the physician or the COO may be in another building when a violent situation arises. And so this will allow an advanced practice nurse to be able to de-escalate that situation and hopefully eliminate or lessen the injury rate that's going on. This is a small step. There are other things that we need to look into. Obviously, the facility, a newer facility with newer mental health practices should help that. And we're going to continue to work on those policies that make it a very dangerous place for the employees to serve those individuals that are housed there.
This, at least, sounds like it's more or less dealing with incidents before they happen. Is a greater concern looking for a way to then deal with incidents as they happen? In other words, you've had a patient strike someone. What can that person do to defend themselves or react to the situation when it's happening?
They're not allowed to defend themselves, and that's what is so unique about this hospital situation, is they are not allowed to defend themselves. And so when you have someone that is completely out of control, intent on physically harming you or trying to kill you, the individuals who are employed there, these are life-altering injuries. And so in an effort to de-escalate the situation quicker, this is one small step in order to do that.
And when we talk about they're not allowed to defend themselves, why is that? We're talking about the federal regulations, aren't we?
A lot of that is the federal regulations and the standards for the hospital. If you defend yourself, then it's deemed as a point of aggression toward a client, and then you're an abuser, which means you can't work somewhere else, for instance, the Department of Corrections. So it's a huge issue for those employees that are trying to do a good job, do their job well, when you have a very violent client there that their intent is to hurt and harm you because maybe they're coming up for trial. And they don't want to go to prison. They want to stay at the Fulton State Hospital. And in their eyes, the way to do that is to physically injure someone else. And these injuries, so many of them are life-altering. Head traumas, orbital bones shattered, jaws shattered, backs, knees, and it just goes on and on.